Hi, if you're watching this, then you might have recently been diagnosed with Vulvodynia or Vaginismus. In this video, you're going to learn what they are and how to get better. It is totally possible to get better from both Vaginismus and Vulvodynia.
So first of all, Vaginismus is related to the tension of the vaginal tissues and the amount of movement possible within those vaginal tissues, often related to tension within the pelvic floor muscles. And that can cause problems with inserting tampons, with intercourse and penetration. You can get a lot of pain. Some people can't achieve the insertion of a tampon or achieve penetration because of the tightness around that area.
Vulvodynia is a bit of a catch-all statement, which is a bit like saying you're currently wearing a blue t-shirt. It is just a word that we use in medical parlance to all know what we're talking about. So you've got a dynia, a pain, in your vulva. It doesn't mean that you're going to have this for life, it's just a current statement. You are wearing a blue t-shirt. Vulvodynia describes any kind of pain that you can have in the vagina, and quite often there are really easily recognisable reasons why you have some soreness and some pain down there. And then remember, the vulva is the outside bit of your genital organs. Our top tips for Vulvodynia.
First of all, test if you've got an infection, or whether it's bacterial vaginosis or thrush. Test if that's the case, and if you do have, then you need to go down the line of treating that.
The easy ones to get away with straight away are things like BV, if you've got any kind of bacterial infection or recurrent thrush. And the first thing that you need to know is, have I actually got BV or thrush? And there's some really simple tests that you can do. You can get them over the counter from Caniston, and some other people make them just to see.
There's a Canis test, is it?
Canis test, yeah. And if you're able to, then get yourself to the GP and get a proper test done. Get someone with a medical understanding to have a look at you.
Yeah, and sometimes people will come into clinic and they'll be talking about this recurrent thrush or this recurrent bacterial vaginosis, maybe related to your menstrual cycle, or maybe related to intercourse, or maybe related to your diet or stress related to your work, or it could be lots of different things that you've noticed linking into the recurrence of these problems. But if you're tested and it comes back negative, it may well be related to the health of that pelvic region, so how healthy it is. And it could be related to maybe tight pelvic floor muscles that are increasing friction in that area and causing irritation and inflammation and symptoms like that. Vaginal dryness as well, that can come into it.
And often they're one and the same, that if you've had a tight pelvic floor for a long period of time, the blood flow isn't there to allow your vagina, which is the inside bit, to produce mucus and that normal discharge that all women have, that will come down and lubricate. So you don't have the lubrication on the outside or the inside, and then that can make you quite sore and dry. Which can cause some of this Vulvodynia. Often with recurrent thrush, there's potential two underlying issues. One is you may have too much sugar in your system. You need to cut out all sugary foods, including all things like carbohydrates, for a while. Fruit, sugars, anything with a high level of sugar, fructose, sucrose, lactose for a bit. Not so much lactose, fructose, sucrose. Tip number 2.
Have a pelvic floor assessment with a pelvic health physiotherapist, I would say.
Yeah.
And you don't want to end up firefighting the symptoms if you're not getting to the root cause of the problem. So if you're very regularly taking Caniston treatment, as an example, or you're having antibiotic treatment on a regular basis and your symptoms are not changing, then you've got to ask the question, am I getting to the root cause of this problem? And quite often something that a lot of women miss out on is pelvic health assessment.
Yeah.
So it would be worthwhile, if you're dealing with this as a chronic problem, access your local pelvic health physio, either NHS or private. There's lots everywhere. I think the Squeezy app has got
yeah, I'll put a link down beneath this downstairs to the Squeezy app, which has a find a physio where you can put in your area in the UK, and they will send you the details of the physios that are local to you that you can get in touch with, including the NHS. The easiest way forward is to go to your GP and get referred, but you can find private practitioners as well as NHS on Squeezy. So
make sure that you know what is going on in that region, so they can look at the dermatological or tissue side of things, just to see if there's any problems there. They can look at the amount of lubrication that your body is naturally producing, and also the state of your pelvic floor muscles, whether they're too tight and causing increased friction and inflammation.
Quite often your physio will be able to pick up on whether there is what we call pelvic floor dysfunction. It's a big word, and it just basically means something's got a bit tight. And if you think about being at a desk all day and having tight shoulders, your pelvic floor can also become tight in different areas, and sometimes that can change blood flow, that can change how everything's feeling, how easy it is to move downstairs for normal things to occur, like defecation or emptying your bladder as well, going to the toilet. And that all affects how that area feels, and then that can build up and become an issue where you feel pain in that region. So from a pelvic health point of view, physio, if you have no medical proven infections and that all of that's been dealt with the GP, then physio has a great deal of tools that could help you, that we can, you know, really help with releasing everything, getting you moving and functioning, and optimizing your pelvic health. And they're certainly, from my point of view, and I'm probably speak for both of us, they're not diagnoses that worry us at all. It's very straightforward. If someone comes to clinic, then we know that we're going to be able to really make progress with them generally, and you are going to be getting yourself better in kind of a 3 to 6 month period of time. So I hope that helped, and get in touch, put a comment down below, check out Jill's website or my website if you want to get in touch with us, or have a look at the rest of the channel if there's any other videos that you want to learn about more of your pelvic health.